Today's webinar. So today we're going to start by setting the stage with a brief look at the implications of digital healthcare, and then we'll introduce you to the Imprivata authentication platform and the scenarios in which it has been used, and then look at customers who are actually leveraging the full benefits of that platform, and then wrap up with a brief look at the total cost of ownership and ease of deployment. So let's jump right in. So now that healthcare has undergone a digital revolution and really transformed from paper to electronic medical records, what are the implications that we're seeing? And what we're actually seeing, and really at the heart of that revolution, is that the digitization of that patient and the patient's electronic medical record. And so with that evolution, we've seen emerging challenges and projects which many healthcare organizations are really struggling to address. So with the adoption of electronic medical records, the implementation of an EMR has really become that central focus. However, without a consideration for how workflows are completed, what we've seen is the results can really often make clinician productivity worse, not better. So in studies performed at the start of the push for the EMR adoption, clinicians are reporting they lost on average 78 minutes a day or 6.5 hours per week to the EMR and EMR-related activities, time which they could have been spending with patients instead. Now, although clinician productivity is of concern, it is the tight regulations and incentives that are given to the industry which are driving the EMR adoption forward, like such things as meeting meaningful use. Really, that type of regulatory requirement has been posed challenging. But now that PHI is digitally available, the regulations of HIPAA and high-tech are proving even more difficult for the industry to address. So those regulations are in place, as mentioned, as PHI is now digitally available, which does provide convenience, but also makes the healthcare industry vulnerable to being the target of cybersecurity attacks. So to address these challenges and simplify the shift in the industry towards a digital approach, the IT team has a tremendous number of projects and priorities on their to-do list. Now that's from EMR deployment to meet MU guidelines, to virtualization for increased availability, to implementing barriers to PHI with a focus on their cybersecurity strategy, and the list really goes on. It's a long list, and for most healthcare organizations, more and sometimes much more than is possible to do. So let's start with the problem of security in healthcare. As you're likely well aware, healthcare is under attack. And it seems as if we read about a new large-scale, high-profile data breach or ransomware attack every day. And how large is the problem? Well, according to the Ponemon Institute, 90% of healthcare organizations had a data breach in the past 2 years, and 45% had more than 5 data breaches in the same time period. In 2015, more than 113 million patient records were impacted, and the average cost of a data breach is $2.2 million. So clearly, we are dealing with a massive problem. And then healthcare organizations decide, okay, so we're going to go through extraordinary means to put IT security systems in place and really designed to keep PHI in but not let it out. To keep PHI secure, we've had to build a system of usernames and complex passwords. And on average, hospitals have 30 to 40 different IT systems and applications that clinicians access on a regular basis to care for patients. That means that in the course of a typical day, a clinician may access clinical systems up to 70 times. This creates barriers to patient care, resulting in inefficient workflows and clinicians implementing workarounds, such as writing down passwords, sharing passwords, and leaving access workstations unattended. So a little more convenient, but a lot less secure. And not only does the password problem create inefficiencies, but it really leaves healthcare organizations vulnerable to hackers. The top cybersecurity threat facing healthcare is phishing and other highly targeted attacks that use sophisticated methods to trick your users into providing their usernames and passwords. Now, this is because stolen credentials are invaluable in accessing systems and information. In fact, stolen credentials resulted in 50% of outside attacks in healthcare last year, and in many cases, hackers were able to compromise the network in mere minutes. So what can be done, right? That's probably what you want to know. Studies have really shown that up to 65% of all cybersecurity attacks could have been prevented with multi-factor authentication. And then by requiring a second factor of authentication to, say, access the network remotely through a VPN, you mitigate the risk posed by stolen credentials. And as a result, the use of two-factor authentication in healthcare is on the rise, up more than 50% since 2010. But as you can see, more than half of healthcare organizations still don't use two-factor authentication. And then incidentally, half of organizations also believe that they are not prepared for that next cybersecurity attack. So if multi-factor authentication is so critical to cybersecurity, I'll have to ask you, why aren't more organizations using it? Well, we find that there are unique challenges healthcare organizations really face that make implementing and enforcing two-factor authentication difficult. In healthcare, you cannot simply lock applications and information down. Your clinicians need fast access inside and outside the hospital to care for their patients in a timely way. So there are also concerns about giving clinicians different authentication solutions for different workflows, which is frustrating and takes the focus off the patient. And so we found that there are barriers to deploying two-factor authentication that must be overcome, especially given the increasing risk and cost of data breaches. And so overall, healthcare organizations are struggling to balance security and convenience. On one hand, doing what they can to simplify the process of getting clinicians to the information they need, while on the other, worrying about protecting patient information. And as mentioned, in healthcare, there are unique challenges with selecting and implementing an authentication platform, both to care providers as well as IT. First, is the authentication workflow efficient for users? So adding layers of security introduces the potential to create inefficiency and disrupt workflows. So clinicians need fast, efficient authentication to remain focused on patient care. And then second, is the solution extensible to meet all your authentication requirements? So while improving security by adding two-factor authentication for remote access may be a priority, for example, there are other workflows that are going to be requiring user authentication that organizations should consider when selecting a solution. Otherwise, you may be stuck with multiple solutions for different workflows. And then finally, does the solution comply with the highest standards regulating care? For example, electronic prescribing of controlled substances, or EPCS, requires physicians to use two-factor authentication when prescribing, but the DEA requirements are fairly stringent. So selecting one authentication option for remote access that is not DEA compliant will mean you'll need to identify and purchase and manage a second authentication technology. So the Imprivata authentication platform is designed to address these considerations. It is fundamental to a successful healthcare IT security strategy, enabling healthcare to securely and conveniently access and transact PHI. So on the right-hand side, Imprivata Confirm ID delivers that comprehensive authentication across all workflows inside and outside the hospital. That includes remote access, medical device access, and EPCS, and other clinical workflows such as medication ordering, witness signing, blood administration, and others. And then on the left-hand side, you notice Imprivata One Sign. And Imprivata One Sign is the leading healthcare enterprise single sign-on and virtual desktop access platform that really secures PHI and allows clinicians to focus more on patient care with fast, secure, no-click access to patient data. And also enables healthcare organizations to leverage the full benefits of their EMR and virtualization technology investments. Now, together, they form the Imprivata Authentication Platform, which enables healthcare to securely and conveniently access and transact patient information both inside and outside the hospital. The Imprivata platform unlocks the full potential of technology in healthcare by removing security barriers and ensuring fast, convenient, and consistent authentication across all clinical and enterprise workflows. Now, by making security invisible to end users, the Imprivata platform really improves productivity and allows providers to spend more time focused on patient care. Now, the flexible authentication modalities of the Imprivata authentication platform improve security in a way that is invisible to end users and therefore does not disrupt any clinical workflows or patient care. And the Imprivata authentication platform provides authentication methods which are extensible to meet all present and future authentication needs and workflow scenarios. Also part of embedded authentication workflows that tightly integrate with your EMR and other applications, medical devices, remote access gateways, virtual desktop platforms, and other systems. and also is innovative, convenient, and DEA compliant to give you flexibility to use the options that best fit your requirements. So the Imprivata Authentication Platform offers a broad range of convenient, innovative, and DEA compliant modalities to support all authentication workflows, including primary, secondary, or what we call re-authentication, EPCS, and remote access. And each authentication modality, such as hands-free authentication, push token notification, fingerprint biometrics, proximity badges, and others, replace that manual password entry with fast, automated authentication. And the Imprivata Authentication Platform also ensures workflow efficiency, but from every endpoint. And that's really key when you look at the hospital environment. Every department and clinician within your healthcare organization really utilizes their EMR systems in different ways. So the way in which they leverage their EMR from a patient room may be different from how they access it in an emergency department and how they access from a doctor's lounge. The Imprivata Authentication Platform creates a consistent workflow and clinician experience across your organization. So it's not just about passwords, not just about single sign-on, not just about strong authentication. It's about making workflows efficient, and that's all workflows. So for example, an all too common workflow in healthcare settings is shared workstations, but user-specific logins can really be time-consuming and frustrating for clinicians. And in the past, healthcare organizations have attempted to use generic Windows logins, but these and other workarounds expose various security and manageability issues. So instead, Imprivata OneSign enables fast user switching between concurrent Windows desktops or kiosk workstations, and that reduces the login times while protecting patient data. In addition, the authentication you put in place to facilitate and support these workflows has to provide a consistent authentication experience, and even more importantly, be appropriate. So taking a one-size-fits-all approach to authentication has the potential to interrupt workflows. You need the appropriate authentication method for the right time and access, and the data it's actually protecting. Now, all too often, healthcare IT investments are intensive to select, purchase, and implement. And CIOs have allocated resources to specific solutions, such as an EMR or a virtualization strategy, which are enough to manage on their own without adding additional vendors. So all too often, you're being bombarded with solicitations from potential vendors, however, at the same time looking to consolidate technology investments and experience the full benefit of their initial investment. So vendors who are able to add value need to be less resource intensive and support the strategy which has been created, such as EMR adoption plans and virtualization upgrades. And here at Imprivata, a key focus has been driving that interoperability, across the healthcare organization. So unlike competitors, the Imprivata Authentication Platform supports integrated workflow authentication for every major EMR vendor, Citrix, VMware, and Microsoft RDS virtualization environments, and the industry's broadest range of SIN and Zero clients. Now, this enables healthcare organizations to leverage the full benefits of their EMR and virtualization technology investments by building that transparent, seamless, and really convenient security into clinical workflows that's going to streamline the clinician's experience. So let's take a look at how you can leverage the Imprivata Authentication Platform. What does that balance between security and convenience look like when applied to a healthcare organization? So first we'll start inside the hospital's four walls. In a recent article from Health Data Management, the disruptive nature of a new EMR was reviewed. And the first area where you can simplify the EMR adoption and relieve stress around adopting a new complex system was around click reduction. Now, Deloitte proposed that within 2 clicks, just 2, of the login screen, clinicians should be able to access 80 to 90% of their job functions. Now, Imprivata, we like to take that one step further and increase clinician productivity, saving them up to 45 minutes per shift. And that's done because we have fast, secure, no-click access, which replaces passwords with just the tap of a badge or swipe of a fingerprint. Clinicians are now given fast, secure access to clinical and administrative applications, including the EMR. Now, for the platform, once they're authenticated, there are many workflows within an EMR or another application that are going to require a clinician to re-authenticate to complete that task. Now, this includes medication and other types of ordering, witness medication wasting, dispensing meds, and a host of others. And Imprivata offers sophisticated user authentication for care providers and robust reporting for better auditing of transactions with PHI. This improves security across a broad set of workflows, improves auditing through better visibility into the interactions with PHI, and ensures efficiency with fast automated authentication. Now, another key advantage of the Imprivata authentication platform is the consistent authentication workflow that we enable for your providers. So for example, using our push token notification, your providers can securely access your network remotely through a VPN or another gateway. They can then use the same efficient authentication method for completing various re-authentication workflows. So for instance, a physician who needs to prescribe controlled substances electronically from their home office or other remote location can securely log onto the network and then complete the two-factor authentication process required for EPCS using the same fast push token notification. This ease of use and consistency will really drive adoption and allow you to scale your authentication platform without inconveniencing users or creating barriers to patient care. Now, adoption of VDI technology in healthcare has increased steadily from 2011 to 2015, from 35% to 66% by the end of 2017. Adoption is forecasted to be 81%. So 81% by the end of this year will have adopted VDI technology. And in our recent 2016 virtualization report, every IT representative interviewed said that they would recommend that healthcare organizations adopting VDI also adopt single sign-on at the same time. And in fact, they said they wouldn't move forward with VDI without single sign-on. So SSO and VDI are seen as a winning combination as they completely enhance each other's capabilities. And in fact, with SSO and VDI, login times were reduced from as much as 45 seconds down to 3 seconds. With Imprivata, no-click access provides a streamlined workflow as clinicians access their virtual desktop, enabling smooth roaming to any location within the hospital. Now, once logged in, re-authentication is possible, allowing for workflows such as EPCS. With Imprivata, you can remove the barriers to EPCS adoption created by the complexities of the DEA IFR and limited technology options. Everything is automated, streamlined, and simple. Providers can undergo the proper steps required to start using EPCS and perform the necessary two-factor authentication at the time of prescribing with minimal impact to their workflows, allowing you to eliminate paper prescriptions and the significant challenges that they represent. So let's look at customers who are successfully using the Imprivata authentication platform. Now, HealthEast is one of the largest healthcare providers in the Twin Cities East region with over 900 beds and 10,000 employees. They were driven by user experience and the need for security, which drove them to implement the Imprivata authentication platform before their deployment of Epic. So HealthEast had an aggressive timeline to go live with their Epic deployment, 14 months for all hospitals, and then an additional 6 months for all of their clinics. Now, before deploying Epic, they looked at the implications, starting with just a general need for all-around better security, such as session timeouts and shared kiosk support. And then in addition, they realized that the Epic workflows they were planning to implement had the potential to increase the number of times the clinician is required to log in up to 300 times per day. So with a short Epic launch time frame, HealthEast chose the Imprivata authentication platform for clinical workflow efficiency and DEA regulation requirements around EPCS. They selected Imprivata and completed the deployment within 4 months. They selected the Imprivata authentication platform because it provides complete and efficient workflows, a consistent user experience, tight Epic integration, fast, easy two-factor authentication for EPCS, and really the technology takes care of itself. So as Todd Smith, the VP and CMIO at HealthEast said, our providers, including nurses and staff, just embrace this technology. It's just so easy to use. I would fear to have to take it away from them. And HealthEast experienced benefits such as reduced help desk calls related to forgotten passwords, smooth EMR deployment, over 95% adoption of EPCS, multiple application support, so an app could be activated or profiled within 15 minutes, support for fast user switching, Tap and Go was also adopted quickly and is reliable. And HealthEast said that the Imprivata authentication platform was absolutely the single thing that was successful for their Epic rollout. and was not just a strategic win for IT, but also for the business. Now, Metro Health, their motto is expert care made easy, which the IT staff adopted for its approach to information technology. In an effort to provide higher quality and consistency of care across its network, Metro Health implemented Epic to provide EHR access from the hospital, neighborhood outpatient centers, and participating physicians. Now, while Metro Health had successfully rolled out Epic, they began to identify workflows which could be streamlined to optimize the full investment of that EHR solution. So they found that their users, both ambulatory and inpatient, moved from workstation to workstation, so accessing different applications and data they needed during a shift, and that was really proving to be burdensome. They found that users reconnected to their desktops as often as 60 times per day, with each login taking about 60 seconds. So that's an hour of their day that was spent just waiting for access. Now, Metro Health selected VMware View to streamline and standardize its technology environment, particularly for mobile and roaming care providers. Now, they did realize, however, that that wasn't going to be enough. Although there was now the flexibility to deliver clinical applications and patient information at the point of care, users were still required to provide login credentials at each station. So Metro chose Imprivata due to the tight integration with VMware, no-click access for clinicians, and the ability to streamline DEA-compliant workflows, which is mainly EPCS. Now, the combination of virtualized desktops and Imprivata saved each user about 50 seconds every time they access their desktops. Joshua Wilder, VP of Information Technology, puts it best. Our objective as an IT staff is to give clinicians freedom to perform their daily tasks instead of being forced to deal with cumbersome technology. With virtualized desktops integrated with Imprivata, we were able to meet this objective while maintaining compliance with security and regulatory requirements. So let's look at the solution and how easy it is to actually deploy. Now, one of the great things about the Imprivata Authentication platform is that it all runs off of the same infrastructure. So the same appliances, the same endpoint agents, and the same administrative console. So this means that no matter where you start, with single sign-on, EPCS, remote access, or somewhere else, you can easily build onto the platform over time with minimal infrastructure investment or a need to train any new administrators. And during the deployment of the platform, we have Imprivata professional services team that really has a simple charter, and that's to deliver a signature customer experience. So they focus on simplifying healthcare IT so patient care remains the focus. And to achieve that, we ensure that we are simple to do business with and remove complexity at every stage, and that our collective knowledge is brought to every interaction. Also, we take any opportunity to continuously bridge the IT and clinical gap that exists in every healthcare organization, and do that by focusing on the end clinical use of our product and optimizing clinical workflow across the enterprise. So that focus really results in your success and the success of Imprivata. And with a 95+ customer retention rate, we're really confident in that signature customer experience our team delivers. Now, a little bit about Imprivata, just at a high level. We are a trusted market leader. We're used by over 1,700 healthcare organizations and 5 million clinicians. And Imprivata is a leading provider of authentication and access management for healthcare. We've been in the industry for 15 years. We span across 21 countries, and as mentioned before, we have a 95% plus customer retention rate. And Imprivata is all about enabling care providers to accurately identify patients and access, communicate, and transact patient data both securely and conveniently. And our solutions balance strong security standards with clinical workflow requirements, enabling care providers to spend more time focusing on patients and less time dealing with technology. Providers can reclaim that efficiency, patients enjoy better care delivery, and everybody's security is protected exactly as it should be. So with Imprivata, you don't have to compromise between security and convenience. With Imprivata, you get both. And that wraps up the introduction to the Imprivata Authentication platform. And Miriam, with that, I will hand it back over to you for any questions.
That's great. Thanks, Kim. actually, we do have a few questions that came in here, so I'm just going to jump right into these. So the first one I have here is, it says, you mentioned the platform is available from a single appliance. So is it a physical or a virtual one? And am I required to be an SSO customer in order to use Imprivata Confirm ID for EPCS?
Sure. So those are great questions. So it is an appliance. It could be virtual or physical. We obviously highly recommend a virtual appliance, just a lot easier to manage and service and things like that. But it is available in both formats. And then, no, you do not need to be a single sign-on or a one-sign customer to be able to leverage Confirm ID for EPCS. That's a standalone solution that can be purchased and implemented on its own.
Great. And then the next question I have here, it says, when should I deploy SSO if I'm thinking about rolling out virtual desktops?
Yep, so I've seen a mix of before and after, but really, if you can do it at the same time, it's better. Single sign-on really kind of aids the adoption of VDI, or put it in place beforehand and it'll have that same effect. But typically, it's not recommended to do VDI before single sign-on.
Okay. And final question, let's see, what do you suggest as the best authentication method to use?
I think the most appropriate authentication method, but one that really is as minimally disruptive as possible for the user. So we see people going back to, tokens or extra piece of hardware that someone has to carry. Typically, you want to do something that the user is already handling or has on them or is part of them, right, as a biometric. One of the examples I think of the most convenient authentication methods I've seen is our hands-free authentication. The physician really doesn't have to interact with their phone. It's leveraging a Bluetooth signal. It's extremely convenient and really is invisible to that end user. So they only feel like they're entering in a single factor when that second factor is actually being transmitted. So those are the type that I think is the best, is the minimally disruptive ones.
Yep, makes sense. Actually, and I think this got the juices flowing because now we have a few more questions coming in.
Okay.
This other one addresses hardware. It says, what kind of hardware would be required for desktops for the badge scanning?
Sure. So hardware, there's going to be a badge reader that's going to be required, and we have all different types of readers available. Depends on, what cards you're using as well as what your endpoint is. Maybe it's a laptop, for instance. We have different readers for those. And then on the software side, there is a client install for OneSign, or actually for both of these.
Got it. Okay. And looks like final question now is Imprivata SAML 2.0 compliant? That's SAML 2.0 compliant.
I would have to check with engineering or PM on that. I absolutely know what SAML is and what that SSO language is. But just for a definitive answer, I just have to look into our documentation. So I can follow up after with that answer. Okay,
great. And actually, for the attendee who actually asked that question, if you even want to email me directly at the email address you see on the screen, and I can make sure to definitely follow up with you on that. It's the mlazardo@imprivata.com that you see on your screen right now, and that way we'll get that answered for you as quickly as we can. So I think that wraps up our questions, and again, I wanted to thank Kim for a great presentation. And just one final note, again, before we go today, if you do have any questions or would like to see a demo of the solution of the authentication platform, please be sure to contact me directly. Again, it's mlazardo@imprivata.com, and I'll definitely get back to you as soon as possible and get you scheduled with that. And as a reminder to all attendees that today's session was recorded and it will be sent to all registrants in just the next few business days. So thanks again to everyone for joining us today, and this concludes today's webinar.